So the day has finally arrived. DSM-5 has been published officially on May 18th, and I think that it might be nice just to highlight a couple of things related to autism. The first is that there's just one diagnosis now of autism spectrum disorder. The diagnoses of Asperger's disorder and pervasive developmental disorder, not otherwise specified, childhood disintegrative disorder, all get merged into this. And one of the important things to note, perhaps the most important thing to note, is that the text actually includes directions about how to transition from established diagnoses. So it reads, individuals with well-established DSM-4 diagnoses of autistic disorder, Asperger's disorder, or pervasive developmental disorder not otherwise specified should be given the diagnosis of autism spectrum disorder. There's no reason that the publication of this book should require that people with well-established diagnoses need to come in and be rescreened or reassessed for any reason. There are a couple other things that are probably also worth highlighting. First, that the transition away from those categorical diagnoses to a single autism spectrum diagnosis is supported by the use of specifiers now. So what we're meant to do as clinicians is to indicate when someone has a diagnosis of autism spectrum disorder whether or not they have language impairment, whether or not there's intellectual impairment, whether or not there's an associated medical or other condition that might be important to know about. For example, is there an association with Fragile X syndrome, or does this individual have epilepsy? So there's a place now where we can be much more specific about how we describe an individual than merely by the broader category. There are other more subtle changes, perhaps. One is the inclusion of sensory hypo or hypersensitivities or unusual interests as one of the areas that can indicate that a person may have autism. That wasn't present in the past. And lastly, there's a severity criterion which is meant to give an indication of the level of services and supports that might be required. It's a given that anyone with the diagnosis should receive supports or services, but there are varying levels that may be indicated with the severity measure. It's not meant to capture an overall autism severity, but instead clinicians are supposed to rate the level of supports required as a function of the impairments in communication, social communication, and impairments in communication, or impairments in restricted repetitive behaviors and interests. So there it is. The book is out, and it'll probably be a while before people are formally using it in their diagnostic clinics and so on, but hopefully the transition will be a very smooth one going forward, and not one where we're looking back and redoing things that don't need redoing.